This use case is going to be about community building in the IT technology in the healthcare space in Belgium. So the problem was patients didn't have access to all their data in Belgium. So what would happen if you would break your leg in Brussels and you would get hospitalized in another city in Belgium? It might very well be that that doctor did not have access to all the data. And in hospital, that's most of the time it's pretty important that they have access to all their data. So the company that we were working with is specialized in IT platforms, in IT software, in IT cloud solutions. They had a solution to make that data available all in one place. And we were at the beginning of the campaign brainstorming, how do we get our products at these hospitals? Because it was pretty interesting to sell that product, because in order for the hospital to buy our product, we had to convince the government, we had to convince hospital groups, and the government was, of course, convinced by the people. So we also had to convince the patients that it was an important problem to tackle. So instead of building a marketing campaign or reaching out to politicians who are really hard to reach, we thought, how do we get everyone together and make the problem important enough to actually bring it up as a subject in the parliament, for example, or in hospital group conversations. And our solution appeared to be a community. And why is a community so strong? When you build a community, what you're essentially doing is you're bringing a lot of your target audience together to talk about their problems. That is the baseline of community building. And when people talk about their problems, what they sometimes also like to do is they start hinting to solutions. When you get to talk people long enough about their problems, they start hinting to solutions. And of course, we knew what the solution was, but there was also competitors. In order to build that community the best way, we needed to be patient, because you can't build a community overnight. It can take weeks, months, or even years to build a strong community. A strong community, I'm saying, not necessarily a big community. The community usually works the best when it's an authentic community. People feel respected, when people can share their story. So what we did is we started really small and we created a face of the campaign. The face of the campaign was something with an own story, this person had experienced something in their life with hospitals, but was also linked to the company that we were working with, selling the product. And just because this community had a face, the people inside the community now had an example, now had someone that could lead them, that could actually steer the discussion, lead the discussion. And when we started talking about these issues and created communities on Facebook, but also on LinkedIn, for example, people started to come out with their own stories as well. And then what our objective was, of course, at the end, was to get so many people together to talk about a certain problem that it was so important on country level that politicians and hospital groups couldn't ignore it anymore. The same is with the Me Too movement or with the Black Lives Matter movement, for example. It all started with a super small amount of people, but became a super large movement later on. And what's now happening within these movements generate feedback. People can talk about their problems. And what that generates is awareness and trust. And at some point, the next phase happens, because it all happens in phases. Phase 1 was really about creating a message. And then phase 2 was really about creating a burst, creating traffic, creating awareness about what was going on, making sure people knew about our campaign or about our community. And then later on, the hardest phase started for us, and that was demand generation. Because how do you turn this group of people that are talking about their issues and that are generating feedback, which is all very valuable to you, but how do you convert that into a demand or even sales, if you will? To do that, we were actually trying to identify the stakeholders in our communities. So it wasn't only patients, but it was also people from the hospital CEOs. It was also technicians in the hospitals, but also politicians, for example. It was also competitors. It was partner organizations. And when we started to identify all these stakeholders within our communities, we could go to very tangible platforms like LinkedIn, like email, and actually start reaching out to them. And what we try to do is just start a conversation with them. How about we start a conversation with one politician? How about we start one conversation with a hospital CEO? How about we start talking about data issues with a hospital technician? And we publish these stories so people could see what was going on. Because the problem wasn't the problem itself. The problem wasn't that the majority of the country wasn't aware of the problem. And when you're dealing with such an issue, a community building traffic, building burst can really be the solution. So what I'm trying to say, if you want to implement this for yourself as a self-employed person or as a larger company or as a small or medium company, you need to realize what is the pain and what problem are we solving and how can we build a community around it. And don't get me wrong, a community can already be 20 people. If you have 20 people actively engaging with themselves, it can already be a very strong community. I'd rather have 50 people in a community talking about topics and actually getting somewhere than throwing 1,000 people in a Facebook group and there's almost nothing happening. To close this off is, a community can really help you build awareness and generate feedback, and at the end also lead to a solution, so generate demand for your product. And you also need to consider the platform. So you have a strategy, and then you need to choose a platform. For example, we now had a data issue with patients, but also with technicians. We chose for mainly Facebook, LinkedIn, and a little bit of Google as well. But the reason why Facebook and LinkedIn worked so well together was we needed to talk to the patients, but we also needed to talk to the technicians and to the hospital CEOs and to politicians. So we could have the human aspect of the patients, their patient stories on Facebook. And that worked really well because people liked to talk about their problems on Facebook and it doesn't have to be so professional. And then when we took it to LinkedIn, it all became very tangible because people actually talk with their job title on there and we could actually see who was engaging there and we could actually record conversations with them. We could invite a hospital CEO, we could invite a politician, we could invite a technician, for example, and we could have these conversations publicly, online, and actually bring the stories to life. Because the problem wasn't that the problem was there. The big problem was that the majority of the country did not realize that the problem even existed. So we needed to make the whole country problem aware. And to do that is to build the community, have public conversations, publish it to the world, and see what happened.